Hi, I'm Dr. Rodríguez-Feliz, board-certified plastic surgeon here in Coral Gables, Florida. Today I'm going to talk to you about the recovery after a deep plane facelift. Very common questions that I get usually asked. The procedure, it depends on the scope of work, but the procedure takes about 4 hours if it's just a regular deep plane, and it can extend even 8 hours if we're adding some of the additional procedures such as brow lifts, upper lifts, uh, lower lids, buccal fat grafting, submandibular gland. So it depends on the scope of work. But for a straightforward deep plane facelift, we're talking about 3.5 hours, 4-hour procedure. The recovery in essence is about a week, 5 to 7 days. There's very minimal bruising and very minimal swelling with an actual deep plane, which is one of my reasons why I prefer this technique. I have the patients wear an elastic band. Actually, there is a big wrap that I place for 24 hours after surgery in the regular deep planes, and for 3 days in patients that I do submandibular glands. Also there is a drain that stays in there for 24 hours in the regular deep plane, but 2 drains that stay for a little bit longer, 5 days or 7 days when I do submandibular glands. After those 24 hours or 3 days, I remove that big head wrap, and we place an elastic band that has ice pack that the patients apply ice for 20 minutes on and 20 minutes off. Then the patients, I tell them to rest for that first week, and usually after 1 week, once the sutures are removed, I allow them to start walking and getting more active. At 2 weeks, I start them on some light exercising, nothing of impact. At 4 weeks, they can start doing more impact work and lifting weights. And at 6 weeks, they essentially can go back to normal between 6 to 8 weeks. Elastic band, we already talked. The incision, so like I mentioned, the sutures are removed at about 1 week. Sex, I usually allow them to at least have 4 to 6 weeks of until everything heals. The main problem with sex is that they can have actually hematomas as the blood pressure goes up. Nutrition, so everyone asks me, what can I eat? We always want you to have a healthy diet, but more important than what can you eat, is very important to stay very hydrated during the first few days after surgery. It's going to improve actually the swelling as well. Sleeping, so we recommend that the patient sleep with one of the pillows that people use for travel, because it allows you from moving the face from side to side, and also with the head elevated, and it's usually for the first 72 hours to allow for some of the swelling to come down. And then always patients ask me, can I sleep with my face on the side and face down? Well, we know from research actually that sleeping on your side or down is not good for your wrinkles in your face. So we always recommend to try to sleep with your face up, but at least to try to prevent any movement to the sides for about 4 to 6 weeks. And then shower, and I let the patients shower 24 hours after the procedure. They can get their hair wet, and that's usually the case. The only other thing I didn't put in here, it's when can I dye my hair? So usually we like to wait about 4 weeks to allow you to dye your hair again. So these are some of the common questions that we get asked for recovery during a deep plane or facelift procedure.